Alcohol slows the functioning of the central nervous system, changing emotions, perceptions, judgment, movement, and vision. Increased amounts of alcohol can make someone lose balance, become confused, slur his or her speech, and even lose consciousness. Alcohol is a drug found in some beverages that slows down the central nervous system and harms body organs. Adults can buy and consume alcohol legally. Teens can neither buy nor consume alcohol legally. When a person drinks alcohol, most of it is quickly absorbed into the bloodstream. The body converts the alcohol into a chemical. In most people's bodies, this chemical changes into carbon dioxide and water and is eliminated. In some people, however, a small amount of this chemical goes to the brain and becomes another chemical known as THIQ. This can cause this person to become addicted to alcohol. Blood alcohol concentration, or BAC, is the amount of alcohol present in a person's blood. BAC is given as a percentage. The higher the BAC, the greater the effects of alcohol. In the state of Illinois, a BAC is 0.08 that is considered intoxicated. Intoxicated refers to being physically and mentally impaired as a result of alcohol consumption. Muscle coordination, reaction time, balance, and judgment are severely affected. Once alcohol enters the bloodstream, it travels to all parts of the body. A special enzyme in the stomach helps break down some of the alcohol. The rest of it is oxidized by the liver. Oxidation of alcohol is the process by which alcohol is changed to carbon dioxide and water. Factors of BAC. We mentioned that BAC stands for blood alcohol concentration, and it is the amount of alcohol present in a person's blood. And these are the factors. How much alcohol a person drinks. The more alcohol a person consumes, the higher his or her BAC is. How fast a person drinks alcohol. Drinking alcohol quickly raises the BAC and may be toxic. How much a person weighs. The lower a person's body weight, the greater the effects of alcohol. How much a person has eaten. Alcohol enters the bloodstream faster when a person's stomach is empty. Whether a person is male or female, the same amount of alcohol produces a higher BAC in females than in males. How a person feels. Fatigue or recent illness makes a person more susceptible to the effects of alcohol. Drinking alcohol has both short-term and long-term effects. Short-term effects are mind and body changes that occur whenever a person drinks alcohol. Long-term effects are mind and body changes from heavy or chronic drinking that last even after alcohol leaves the body. Body senses. The senses of sight, taste, touch, smell, and hearing are dulled as soon as alcohol enters the bloodstream and reaches the brain. Alcohol interferes with depth perception, peripheral vision, and the ability to see objects in the distance. All of these impairments increase the risk of unintentional injuries and decrease the ability to respond to unsafe situations. Reaction time and coordination. Alcohol slows reaction time and reduces the brain's ability to coordinate body activities and control large muscle groups. At the same time, alcohol dulls a person's ability to reason and use good judgment, and it disrupts memory. As a result, people who have been drinking may believe they can perform tasks when in fact they cannot. Alcohol increases the risk of motor vehicle crashes, drowning, and falls. Alcohol is a factor in nearly half of all teen car crashes. Teens who drink can harm their ability to learn, make responsible decisions, and develop social skills. Stomach. Alcohol irritates the stomach by provoking an increased flow of stomach acids. Stomach acids may irritate the lining of the stomach and can cause both heartburn and ulcers. Combining alcohol with aspirin increases the risk of bleeding in the stomach. Long-term effects. Immune system. The immune system contains cells and organs that fight disease. Drinking alcohol suppresses the immune system, weakening its ability to fight infection and increasing the risk of infectious diseases. Drinking alcohol also increases the risk of developing cancer. Mouth, pharynx, larynx, and esophagus. Drinking alcohol causes changes in the cells that line the mouth, pharynx, larynx, and esophagus. There is an increased risk of developing cancer in these organs. Pancreas. Heavy and chronic drinking can cause pancreatitis, an inflammation of the pancreas. Symptoms include abdominal pain, nausea, and vomiting. Liver. The liver filters alcohol from the bloodstream and chemically changes the alcohol to eliminate it from the body. Heavy drinking can cause liver cell damage, which can lead to liver cancer, hepatitis, and cirrhosis. Heart and blood vessels. Heavy and chronic drinking increases the risk of high blood pressure, heart failure, sudden cardiac death, cardiomyopathy, and cardiac arrhythmia. Heart failure happens when a chamber of the heart does not work well enough to keep up with blood flow. Sudden cardiac death is sudden loss of heart function. Cardiomyopathy is a breakdown of the heart muscle. Cardiac arrhythmia is an irregular heartbeat, a potentially dangerous condition. Heavy and chronic drinking or binge drinking also can cause stroke, a condition in which a blood vessel to the brain is blocked. Because alcohol in the bloodstream kills blood cells that carry oxygen, drinking over long periods can cause anemia, a serious reduction in the oxygen-carrying cells. Brain and nervous system. Heavy and chronic drinking reduces mental abilities such as problem solving, abstract thinking, and memory skills. Heavy drinkers can develop alcohol dementia, brain impairment with a loss of many intellectual abilities.